Hi, this is Dr. Slave Gallagher. I'm answering another very common question I get from female to male patients undergoing top surgery, and that's about what happens if I lose a lot of weight or gain a lot of weight. So we'll start first of all with losing a lot of weight. A question I often get from patients who are overweight is, should I go ahead and lose weight first? So that depends. It depends on how much weight you have to lose. If we're only talking 10, 20 pounds, it's really probably not going to make much of a difference to your result or the surgery we do. And in fact, crash dieting or trying to lose a lot of weight right before surgery is never a good idea, because your body's going to need building blocks to repair these incisions we put on there, and it's not going to be able to do that if it doesn't have the building blocks there and the proteins you need to be able to recover after surgery. So I never recommend crash dieting right before surgery. If, on the other hand, you have a lot of weight to lose and you're interested in undergoing massive weight loss or having a weight loss procedure such as a gastric bypass or a sleeve or something like that, it's probably wisest to have that before your top surgery. And the reason is, when you lose a lot of weight, everything is going to deflate and you're going to be left behind with extra skin. So that way, at the time of your top surgery, I'm going to be able to correct some of that extra skin and remove it at the same time. So you just get more bang for your buck. If you've had your top surgery and then go ahead and lose a lot of weight, it's really just going to act like any man's chest would. There'll just be loose skin left behind. So then, on the other hand, if you were to gain a lot of weight, I think there is a fear out there, and a lot of trans guys understand that maybe it's an irrational fear, but there's always a concern that you have your top surgery, you have a nice flat result, a nice masculinized chest, and then something happens and your breasts grow back. So first of all, to debunk that myth, it's not going to happen. When we do masculoplasty or top surgery, we're removing the vast majority of the breast tissue. We do, of course, leave some behind because we want that nice natural result, and every male chest does have some breast tissue there, but there's nothing that's going to happen that's going to cause that breast tissue to grow right back again. If, however, you were to gain a lot of weight, your chest is going to act like any male chest. And there is a thing that men get when they gain a lot of weight, and that's called pseudogynecomastia. Pseudo means fake, and gynecomastia is enlargement of the breasts. So it looks like enlargement of the breast, but it in fact is fat tissue, not breast tissue. And again, so any male chest would do this when you gain a lot of weight, but we're talking a lot. So that's how your chest acts after masculoplasty or after top surgery. It's always my goal to make your result look as natural as possible, and therefore I would expect your chest in the long run, if you have big fluctuations in your weight, to act just like any man's chest would. So I hope this answers your question.